coming out, and I'd love to learn a little bit more about each of you, as well as the things that matter to you and your families as we continue to engage our fellow constituents here.
My background's been in corporate life, and I'm retired now, but I have 15 grandchildren, and I care deeply about the morality of our government. I don't like what I hear. I don't think that people are interested, that represent us, in what's really happening here. They're interested in liberal politics. Mm-hmm. And so I think there's just a lot of issues that affect affordability, and the things that fix it aren't being addressed. You can talk about energy,
sure,
talk about data centers. There's just issues like that. What's your involvement in those, or feelings about those?
Sure. So there's a lot there, and I agree with you that I think as a society right now, we are so hyper focused and polarized around what I would describe as politics as usual, that is really tearing our families and our communities apart around these social issues. But the things that really matter to our families and to you said 14 grandchildren? 15 grandchildren and counting, as well as your sons and daughters, are really the things that, what does it take for them to thrive? Mm-hmm. And those are issues that really are things like affordability, the cost of housing, the cost of healthcare, access to healthcare, whether or not the community they live in is going to set them up for success, or is just going to unfortunately put them on a path that currently, unfortunately, is unsustainable, that will not let them basically fully reach their potential. So I can probably pick on any of those issues that you brought up, but we could start off with something like healthcare. Because, right now in Chester County, we lost two hospitals. Two hospitals went bankrupt here in Chester County. And they really went bankrupt because of liberal policies that really were trying to achieve something that, although noble, which was, affordable care, the Affordable Care Act, by, trying to basically cut the cost of health care. That cutting the cost of health care through Medicaid put two hospitals out of business. And when that happened, it raised the cost of health care for everybody in Chester County. So, we really need to look at sustainable solutions. And although I think there are some noble purposes in trying to go out and, make healthcare affordable, if you don't do it from a viewpoint of sustainability that works for doctors, hospitals, and patients, and really builds a system that really is going to be designed to make sure, our people of any age, whether kids or older adults, have access to healthcare, you're on a path to failure, and that's where we are right now. Todd?
Yeah. So I also worked through the corporate world. Recently retired last year, and so affordability is definitely one of the top topics, and it includes a wide range of things. Medical care is certainly getting unaffordable, and I feel like the policies of the past just didn't work or made the problem actually worse. During the last 4 years, I've literally seen most costs almost double. I look at something like food or simply going out to a restaurant for myself and my spouse, and it's almost twice the price in just a 3 or 4 year span. And so a lot of the policies that have been kind of feeding these social programs, feeding these national political agendas and some of this political theater are really making life worse for the residents in Chester County, because they're not helping us in any way, shape, or form.
Yeah, I agree. And, if you want to look at the root cause to the inflation issue, and I think about it a lot because my kids still like to go to McDonald's, and I look at the cost of a Happy Meal, or basically a call it a Big Mac meal. It's more than double today than it was 4 or 5 years ago. It's shocking, and I think about the impacts of that to the average family. You just normally think I could just run to McDonald's and take the kids out for a quick meal, and you have 4 kids, and suddenly you're spending $50-$60. When it was maybe only $20, $25 again 4 or 5 years ago. And the root cause of this inflation, and I hate to say it, I don't see a quick path to it unless we really start reining in the deficit spending. And, there's a misnomer out there that we are, quote, printing money, and that is somewhat true. But what we're really doing is we're printing debt, because the deficits that we're spending, whether it's at the federal government level, the state level, the local level, are all being fueled by debt. So it's not just that we're printing money, we're printing debt. And that debt, unfortunately, can now only be repaid by issuing more debt. And that's where we are. So we're spending over $1 trillion just in servicing the public debt. We don't have the money to service that $1 trillion, so we just print more debt. And you see that it's sort of cascading kind of everywhere. One of the reasons I'm so focused on healthcare is if we have any shot at balancing the budget, healthcare's got to be the path. It's got to be getting rid of a lot of the fraud, waste, and abuse and general inefficiency in the system. To put in some perspective, although, when you look at basically what's the Pennsylvania state budget or the federal budget, the biggest line items are healthcare related, and it's the cost of all the middlemen in the system, the fraud, waste, abuse, and inefficiency. So if we can get rid of that, we can start, getting healthcare from 18 and 19% of GDP to more like 12% of GDP. That would take a lot of pressure off our deficit spending and actually give us a shot at getting inflation back in line. But unfortunately, given the path that we are on right now with these deficit spending that we're doing really across the board, I don't see a way of basically containing inflation. And again, the misnomer is we're printing money. We're not printing money. We are issuing more and more debt that is really slamming the younger generation right now. Because although I think older folks like ourselves might be further along and more established owning homes, all that debt is hitting sort of Generation Z and iGen and even the millennials kind of head on. And that's where you see really the affordability issue.
Marty, I wasn't that interested in healthcare when I first heard about your candidacy. And then you said something that blew me away. And I think most people don't realize how much. Now, you've developed a plan. Most people don't have a plan. You actually developed a healthcare program that could be a national program. Could you tell us how much that could reduce the cost? This blew me away to the user, and ultimately, would it improve our health care?
Yeah. So the good news is it's more than a plan. It exists today. It covers 10 million people today. It's called TRICARE. And, it is a program that was developed by the U.S. military, really as a result of the global war on terror. And we had, millions of soldiers, sailors, airmen, and Marine deployed for the last 20 years. And many of them were not deployed from the major military bases. They were coming from our local community, the National Guard and reservists. So people were coming from Westchester and Coatesville and Reading and other places around here. And when they had, kids and spouses with medical issues, they couldn't send those kids and spouses to Fort Dix. They had to send them to basically local hospitals, local pediatricians. And so consequently, we built the TRICARE private care system. And that system covers 10 million people today. It includes Chester County Hospital and Paoli and Mainline Health and CHOP and Nemours and Tower. Everybody takes TRICARE around here. It is less than half the cost of Medicaid, and it's less than 25% the cost of private health care insurance.
Who knows that? That's amazing.
So one of the shocking things is really pretty much everybody who oversees TRICARE knows this, including our own current Congresswoman, Chrissy Houlihan, who is the ranking member of the Armed Services Committee overseeing personnel, overseeing TRICARE. And the economics are shocking. And the reason is there's only one middleman, a TRICARE contractor that has to recompete for the contract every few years. So the solution to our healthcare crisis isn't, quote, single payer, it's single middleman. That's the solution, and TRICARE is that solution.
And I'm betting some of these people that don't pursue this are being funded by some of the insurance companies that make money on some of these programs that are expensive.
Yeah.
Would that be a fair question?
I think that's a very fair point, which is we've built a system that is completely rigged against families, against small businesses, and even against patients and doctors.
Sure.
And the reason is, as Ross Perot warned us in 1992, it's all the lobbyists running around Congress that are more than happy to let the political theater and drama continue while they work the back rooms and pass laws that nobody ever really reads, but basically enriches, in particular, the big five healthcare insurance companies.
Mm-hmm.
Was a big concern for myself as well. As I look at where our economy is, the deficit, the various discussions that you see some of the congressmen and senators having on TV. Medicare and Social Security are basically going to run out of funds within 5 or 10 years and disappear, or there's going to be some dramatic change. And so finding a solution that's sustainable, not just a Band-Aid that lasts a year or two and puts us in more debt or compromises something else to Band-Aid and win the next election or win the next lobbyist is really important to the sustainability of the retirees and the country in general. I mean, my own, other relatives have trouble paying for their own health care for their children, and it's, they have to make compromises and go into debt in some cases to pay off bills, and so we really do need to focus on a solution there. And that's what you're discussing here. It sounds like for once looking at a root cause and a real solution instead of looking at political theater and lobbyists.
Yeah, I agree. Like we're at the precipice of something scary in the next few years, and we've heard alarmists for decades talking about the issue you brought up, which is at some point in time, Social Security will run out, the trust fund is gone, but our own Congressional Budget Office now forecasts that in 2030 we will have more deaths than births in this country, and when that happens, we are in a precipice. That's only 4 years away. It's less than 4 years away. We already see in the data right now in the average fertility rates of young men and young women. And when we cross that line, there just simply aren't going to be enough younger folks to take care of the older folks. So we're going to need to do a number of things, and we got to do them smartly. In that, first of all, we need to basically help our young people succeed. We need to help them basically be able to afford not just homes, but having children and families of their own. That's got to be the biggest priority, because if we fail there, this whole thing fails. And then a second thing is we need to really rethink immigration, but we can't do it in the haphazard way that has been political theater the last 20 years. We really need to think about smart immigration that really prioritizes economic growth, protects American families, helps stability of basically growing families. And ultimately, we're going to need to plug the hole with not just immigrants, but immigrants that want to actually have families here. Because at the end of the day, families have got to basically grow and succeed, not just here in Chester County and Pennsylvania 6, but across the United States. And if that doesn't happen, unfortunately, there's nothing stopping what's going to be going on next decade.
I've been a bit impressed with your background. I found out you're a West Point graduate. You're a lieutenant colonel in the reserve, and you're also, this is what fascinates me, a turnaround specialist in business. And I think people would love to hear more about that.
Sure. So, and you're right. So, being an Army chaplain initially as an infantry officer, and then a turnaround specialist might sound like two very different things. But what I found in many cases, whether it's in our personal lives or business lives, there's always sort of the head and the heart. And in many cases, a lot of people kind of know what the right thing to do is, but their heart isn't necessarily there yet. Or their heart tells them what the right thing is, or their head is sort of not quite there yet. And so what I found is, many, for example, executives know that if they don't make some big changes, their company will go out of business. Like they mentally know that, but their hearts aren't into making those hard decisions in order to save the enterprise. Mm-hmm. And sometimes those enterprises fail, or you go find somebody who's willing to make those hard decisions. And likewise, you have people who have all the heart, but they don't really know exactly what the right thing to do is, and they fail as well. And you really have to sort of have that connection of both head and heart, whether it's in making big decisions in your personal life or making big decisions in corporate life. And I feel like we as a country right now, I feel like both our heads and our hearts are divided as a country. We have to sort of bring unity, not just to the traditional Democrats, Republicans, and Independents, but we really need to basically align what's right in our hearts with what's right in our heads. And if we do that, we can, I think, not just build unity, but bring real solutions to bear.
Well, I mean, that discussing the military, that kind of leads into the whole security topic.
Sure.
As we get older, one of our biggest risks is being a victim of crime, whether it's illegal immigrant crime, terrorist crime, cyber crime, simple, petty theft kind of crimes, and this whole defund the police attitude that I've seen on some of the political theater is just insane in my mind. I actually walk up to veterans or police officers when I see them and say thank you for your service, because I appreciate them being there. I appreciate the risks they take to protect us, and so I'd like to hear your thoughts and ideas on how do we return to normalcy in security and protecting our citizens.
It's a great topic you bring up. And my observation, there's a lot of confusion with things like, for example, ICE or things that are going on in our local and state police departments. And I think ideally we have to understand that I think one of the geniuses of our system is we have law enforcement at the local level, at the state level, and at the federal level. And each one has actually a very vital role to play because certain types of law enforcement are most effective at the appropriate level. And so when I think about local police officers who are really trying to keep their local community safe, we want to make sure that we're setting them up for success, that we're not putting them and their families in any kind of a jeopardy just by doing their jobs. And when local problems are bigger than what that local police department can handle, the right support from a state and federal standpoint are there. But ideally, the way law enforcement should work for things like petty crime, non-institutional crime, should be kind of at that local level, being supported by state and federal resources where appropriate. I think, though, that there's also, unfortunately, a level of organized crime that is really just astounding. And I think when we think about law enforcement, we got to remember that there are countries in this planet that have GDPs that are larger than states in this country, all based on committing fraud against seniors in our country. They're fraud-based economies, and that's not something your local law enforcement is going to be able to address. But that's something a federal government with its law enforcement resources should be able to address in cooperation with state and local authorities. Likewise, we have people trafficking other human beings into this country. That is primarily a federal, law enforcement mandate, because a local or even a state law enforcement agency isn't going to be able to go up against an international drug cartel. Not going to be able to do it. So we really need to, I think, eliminate a lot of the confusion and understand that we need law enforcement at all levels, and we need cooperation at all levels. And so when we have this lack of cooperation at the state, local, and federal level because of, unfortunately, political agendas, people get hurt. And what really troubles me is law enforcement officers at all levels get set up to fail. And these are people we do not want to fail. We want them to succeed. And so we really need to, I think, have better coordination, clearer policies. And if there are states and local governments that don't want to support federal efforts against things like, international cartels and trafficking and fraud rings, we have to understand that if they're not going to cooperate, then we need to figure out the best way to basically mitigate the damage. Because without their cooperation, it's going to be suboptimal for the people in their community. And the people in their community should at least understand the consequences of lack of cooperation when it's basically when it's not supporting really ultimately the safety and welfare of their community.
One thing that's very important to me, and with my 15 grandchildren, half of which are girls,
Yeah.
is that people like Chrissy Houlihan are still voting to keep men in women's sports. Even the Olympics have stopped it.
Mm-hmm.
And it's very frustrating to me. And I find out most people don't even realize this. It's an 80% issue. The country doesn't want that to happen. And I have a sense I know what your position on it is. And yet I just wonder how that kind of a voting record could even still be going on with so much resistance to that.
You know, I think going back to why is our healthcare system so broken, I'm fully convinced that there are corporate interests that are making a whole bunch of money off some of these transitions that are going on. And let's call it what it is, because, you know, I look at certain things like this and I just sort of follow the money, and you look at it and you realize that this really more is a money issue that is creating a whole bunch of division within our country. But when you sort of pull back the curtain, there are folks out there trying to sell drugs, surgeries, creating essentially, unfortunately, if you go through one of these transitions, you're a 30-year revenue stream for somebody, 30 years of revenue because of the drugs and the surgeries, et cetera, et cetera. And there are special interests there that are, you know, very, very interested in milking that system. And I look at, unfortunately, other things that have happened that have not been good for our society that might sound very good to some, but it really there's just, unfortunately, a money agenda behind it. And it's really troubling and devastating. And so, you know, why are people voting for things that are against these 80% issues? I think the answer is donors, money, corporate greed. And I can give you a positive example if you'd like, something that we should all think about. You know, one of the things that, you know, we should do as particularly Pennsylvanians, because we have so many energy resources in the state, but one resource that we have is we live in a latitude where geothermal makes a ton of sense. It is way more economical than solar. It is, if you want to, you know, reduce, you know, people's electricity bills, not just for 25 years, because solar panels last 25 years, but a household for 150 years, do geothermal. But the problem is geothermal is a local business. It's going to be our local drillers. It's going to be our local HVAC specialists. Mm-hmm. There's no big corporate interests behind it to push it. Mm-hmm. And unfortunately, you know, something like that, which makes all the economic sense in the world to a home builder or to a family or a homeowner, has no one really pushing it. So, but we really, as a people, we really need to start looking at what are the things that really can move the needle, that create long-term sustainable advantage, not just for our country, but for, let's call it our household economics, things like that. Mm-hmm. And we miss them because, you know, you have corporate interests that are more focused on things that are not sustainable, and that might make some money in the near term or even the long term, but in the long run are not good for our society.
Yeah, I mean, I was surprised when I saw Chrissy was actually voting against things that helped the Pennsylvania economy, like against the liquid natural gas industry. And a lot of the power plants are powered by liquid natural gas. And we see New Jersey and Maryland and others are shutting down viable plants, pursuing a climate agenda. But it's leaving higher prices for the entire multi-state area that's fed off of that same grid of power. And so we're getting double whammied by regional politics in other states and federal policies that Chrissy is hitting us. So how do you think we try to solve some of those things?
And you know, I'm all for the environment, but we have to do it responsibly. And natural gas is one of the most responsible things you can actually do for the environment. And what is sad, because I don't know no other way to put it, is because we're not using the rich resources we have here in Pennsylvania, the cost of natural gas isn't just higher for Pennsylvanians, it's higher everywhere in the world. And because we're not fully participating, the Russians are. And so the Russians are making money at higher rates sustaining now a war in Ukraine because we're not participating the way we should. And it's, if you think about, the global picture, it's really kind of shocking. And, I think I don't have the data in front of me, but when you look at states with, rich natural gas reserves, I think we're like second in the country. And I think Pennsylvania, if you put us against actual countries around the world, we're maybe top 5 in the world, and we don't use it. And so our lack of participation is actually not just hurting our families here, but it's actually even jeopardizing national security in places like Europe, because the bad actors are just filling the void. And something that, honestly, I don't know why we're still not addressing right now, because it's kind of one of those common sense things that would be good, not just for people here, not just for our fellow Americans, but people all around the world, would actually probably make the world a safer place.
One of the other things I see on the national level as I just look towards the long-term future, knowing, I'll be dependent on the next generations, is the education crisis. I mean, the reading, the math scores are just abysmal across the country and even some of the local area. How do we get that really back on track? Because if we don't have the ability to read, the ability to do math, to do common sense reasoning that math teaches you, you really don't have an electorate that'll be able to create a good country and continue our democratic republic, constitutional republic.
So I think, unfortunately, for the last 20 years, and you can almost sort of look at it there, really when the internet came onto the scene, again, big corporate interests really wanted to push electronics into the classroom. And by doing that, it really served a couple of agendas. One, it sold a lot of laptops and screens, where even here in our public schools, it's mostly every kid has a screen now, and issued by the public school. I think the second thing it did is it really consolidated the learning around really digital agendas that are not necessarily designed to create critical thinkers, but they're designed to create test takers. And there's a huge difference, because these sort of online curriculums are really optimized to get really good quote scores. And now you have teachers that are no longer being teachers, but they're really being coaches for kids to take standardized tests. I think the solution ultimately is actually rolling back and getting the technology out, and moving back to pencil and paper and pen, and kids, getting the distractions out of there. Even just the social media that happens on these school devices, and schools are even using social media, things like Instagram, to basically push out learning curriculums. But what we see what the social media is doing to our children. We're seeing other countries just outlaw and ban it for 18-year-olds and younger, and yet we're bringing it into the classroom. So I don't know any other way to fix this other than doing something that would cut a whole bunch of costs out of the system, because all the IT staff, all the computers, all the time teachers have got to basically get up to speed and managing all the devices in their room, et cetera, et cetera. If you move back to something that was a lot more traditional, that's proven its work for thousands of years, I think you'd see much better outcomes.
I know we're almost out of time, but I have one last question.
Yeah.
Christy Houlihan will not support proof of citizenship to vote. What's your answer to that?
Yeah, it's perplexing why the SAVE Act isn't passed yet. It's perplexing.
80% issue.
Yeah, and let's call a spade a spade. The Republicans are in charge. Republicans can't even get it done, and you're right. Christy Houlihan hasn't voted for it either, and it is perplexing to the average, I think, voter and citizen like me and you. And I think I think that one, we should pass the SAVE Act. We can make it a little bit easier for people. Maybe you don't need to prove you're a U.S. citizen at the poll, but you have to prove who you are at the poll. And there are going to be consequences if you're a non-U.S. citizen and you vote, severe consequences. And I think that's probably the compromise. What's interesting to me is that nobody really seems willing to compromise on really a common sense fix. And, just prove who you are. That's it. Just prove who you are. And if you're a U.S. citizen, we'll take you at your word. But when we do the audit and you're not, there are going to be some severe consequences. Well, thank you both for your time and the short conversation. And I look forward to continuing these conversations in the community.
Thank you.
I wish you
very
and your
much.
families the best and hope that they succeed because your grandchildren are actually our future and yours as well. So
We
thank
got
you.
our vote.
Thank you very much, Marty. Thank you.